Assalamu alaikum. Good afternoon. It's a pleasure actually to stand in front of you and talk about an important topic actually that has been addressed even with my colleague previously as an important risk factor for cardiovascular disease. The task today is just to talk about a very specific or focused element, which is improving the recognition and management of hypertension. Despite the efficacy of blood-lowering therapies, and you all know we're having more and more new medicine every now and then for treating hypertension, we're able to actually lower our blood pressure. And with the presence of and the evidence of lifestyle modification, more than half of people with hypertension remain untreated and control rates are unacceptable. The prevalence and burden of hypertension is highest in middle income and low income countries, with the majority of deaths associated with blood pressure reported from these regions. There was a study, the prospective urban-rural epidemiology study found that 33% of individuals from the Middle Eastern countries, it was a group of Middle Eastern countries, Iran, Palestine, Saudi Arabia, United Arab Emirates, had 51% suffering from hypertension, and 51% who were unaware of their diagnosis. And this is a big problem, not just having or not well controlled, they don't even know that they have hypertension. And 47% of people with hypertension were treated, only 19% had controlled blood pressure levels. These are really scary numbers in our region. A study from Saudi Arabia specifically reflect low levels of hypertension awareness and blood pressure control. Between 39 to 55% of individuals are unaware of having their disease. And most people with hypertension receive pharmacological treatment, but overall rates of control remain below 50%. 20 to 35% of people with hypertension are uncontrolled on their treatment. So unhealthy lifestyle, low physical activity, obesity remain some of the most prevalent risk factors for hypertension in Saudi population, even among our younger individuals. The obesity trend is increasing significantly in our community, and that's because of our lifestyle, because of our diet and lack of activity. Other common risk factors in Saudi population are diabetes and hypercholesterolemia, and as Dr. Waleed showed, the combination of these risk factors increases the risk significantly. So early screening and detection is critically needed in Saudi Arabia. In addition to national campaigns raising awareness about the disease, its risk factors, and preventive measures. Updated guidelines are needed to guide the management of hypertension in Saudi Arabia and improve treatment outcomes. And that was one of the initiatives that we led with the National Heart Center and Saudi Heart Association, is updating the guidelines. I know there are more updated guidelines this year that have not been adopted yet, but the latest was published in 2023 guidelines. And I think even with those guidelines, we do have a big gap. We do have under recognition and under treatment and low control of our disease. So with these guidelines, we felt the need to recognize and improve the healthcare and blood pressure control in the Kingdom of Saudi Arabia. I'm not going to go into the deep details of the guidelines, just to point out as a start, identifying the need, identifying the guidance for the blood pressure control is very important. And it starts by defining blood pressure. And many people don't even know what is hypertension. Yes, the recent ESC guidelines pushed it further down, but I think if we even stick to our guidance, hypertension is diagnosed if blood pressure measurements in an appropriate way is above 130/80 according to office measurements, daytime readings of ambulatory blood pressure measurements of the average of home-based blood pressure measurements. We also took into consideration if it was ambulatory blood pressures versus 24-hour blood pressure, and if the nighttime readings are more than 110/65, it could be isolated nocturnal hypertension. And then we really stated the importance of when to treat the hypertension, and according to where did you measure the blood pressure? Many times, just relying on one measurement, whether it's the office or one or two readings at home, is not enough. You might need further clarification for that. So recommendation of screening is very important. We do recommend of screening for hypertension for all adults above 18 years at each visit to a healthcare facility whenever feasible. And that's an important point. We get lots of people visiting healthcare facilities all over the kingdom for many reasons, but they might not get their blood pressure checked. It is very important to check it, even if the person is coming for an eye check or a throat check. They should have their blood pressure and raise the suspicion for that. Annual screening is recommended for individuals older than 40 or those who have risk factors for hypertension, and screening for the general population is recommended every 3 to 5 years. After therapy initiation, if you initiate therapy, patient follow-up is recommended. Very close follow-up is very important to make sure that the control is achieved. In people with uncontrolled blood pressure, follow-up is recommended, more closer probably for better adjustment of medication. In people with controlled blood pressure, a 3 to 6 month follow-up is reasonable. Very important, and I think it's a population need to stress on lifestyle modification, and should be recommended for all people in general, but specifically for those who have hypertension. Pharmacological management is very important. We did specify who we could start with monotherapy. We do recommend to start from the beginning with dual therapy, and when to adjust for that without going into the details because of the time. There was also an initiative for the American Medical Association that looked into the actual factors that affect the control of blood pressure, and these are several factors and a combination of factors. It might be therapeutic inertia, it might be diagnostic uncertainty, it might be treatment non-adherence. We know that we have in the community an adherence problem to medications. Many of our patients would be recognized as hypertensive given medications, but they don't adhere to taking it in the right time. So it's very important to measure accurately, act rapidly, and partner with patients to achieve the control of your medications. So we need to apply the policies very importantly. We need to expand from focus on clinical care, healthcare officers or practitioners to include efforts that affect healthcare policies. We need to involve the policies from many legislations, the National Heart Center, the Ministry of Health, the hospitals. They all need to collaborate together to get these policies effective. Efforts primarily focused on aligning patient insurance coverage and provide the reimbursement. Now with privatization and many private hospitals, insurance bodies are very important to understand the targets, the needs, and the coverage for the patients. Collaborative efforts should aim to address policy change and other national and institutional standards to support evidence-based practices. Public awareness, it's very important. Many times the patient is the one who recognizes the problem. They are the ones who come and request the treatment. If you don't get the patient on board, no matter what you do as a clinician, you will never be able to achieve the target or control their disease. So patient awareness and patient engagement remain essential parts of hypertension improvement strategy. Public awareness campaigns, and I have to address that we have yearly been doing public awareness campaigns through the Saudi Heart Association to increase the awareness of patients about hypertension and about the risk factors of cardiovascular disease, emphasizing on the risk of hypertension causing heart attacks and strokes, encouraging blood pressure care and control, and normalizing the practice of home and blood pressure monitoring. How many times did you get a patient who tells you, but I don't feel anything, I don't have a headache, why should I take medications? Increasing the awareness and improving on patients' awareness of the risk of being hypertensive, not just relying on symptoms, is very important and crucial. So there are definitely many challenges and opportunities, whether it's scientific, the human factor, financial, regulatory, technical, organizational factors. we need to have the power to concentrate or get all this together to reduce these challenges and the effect they have on achieving our target. With potential to accelerate or decelerate progress toward promoting health, we need to understand that by controlling, and people understand by controlling blood pressure, preventing heart attacks, strokes, and other medical consequences, and eliminating health disparities. With that, I hope I didn't exceed my time. Thank you very much. I'm looking forward to questions.